What does it look like when your heart almost dies and you don't feel a thing? Inside your chest right now, a fist-sized muscle is doing the one job nobody asked you to do. Sometimes a small part of that muscle is being slowly starved of blood. You don't feel it until the day you do. That day has a name: heart attack. But there is a way to see that day coming weeks before it arrives. It involves a needle, a treadmill, and a camera that doesn't take pictures of light. Here is what actually happens. You walk into a clinic. A nurse runs a fluid into your arm that is very quietly radioactive. You climb on a treadmill. The treadmill speeds up. You run. Your heart rate climbs to a number it has not seen in years. And while it is up there, struggling, that radioactive fluid quietly maps every square millimeter of muscle that is still pulling its weight and every patch that is starting to fail. Then you lie down under a camera that takes a picture of where the radioactivity went. Where the muscle is alive, the picture glows. Where it is dying, there is a hole. And here is the part nobody tells you. A hole on that picture is the best news you will ever get. Why? That answer is in the next 2 minutes.
Why does a tiny piece of radioactive metal only stick to living cells inside your heart? The fluid in the needle has a name: technetium-99m sestamide. Doctors just call it sestamide. But sestamide is not just a tracer. It is a tiny radioactive metal cage designed to do exactly one thing: sneak into a heart muscle cell and only stay if the cell is alive and being fed by blood. A healthy patch of heart muscle gets plenty of blood. The cage walks in, the cage stays. A patch behind a blocked artery gets less blood. Less cage walks in. The picture comes out faint or completely empty. So the radioactivity becomes the messenger. The metal cage gives off a soft, low-energy gamma ray, about 140 kiloelectron volts. That ray travels straight out of your chest, through the camera, and into a crystal that flashes a tiny burst of visible light every time a ray lands. Now scale that up, hundreds of millions of rays. A camera that rotates around your body, taking thousands of pictures from every angle. A computer that stitches the angles together into a three-dimensional model of where the cage went and where it didn't. That model is your heart. The bright parts are alive, the dark parts are starving. And the difference between a bright spot at rest and a dark spot under stress is the diagnosis a cardiologist has been waiting for. But here is the trick. The test cannot do its job with one picture. It needs two. Why? Next.
Why does a doctor need 2 pictures of the same heart, taken hours apart? Because at rest, your heart is a liar. A blocked artery doesn't always cause a problem when you are sitting still. At rest, even a half-blocked artery delivers just enough blood to keep the muscle quiet. The picture looks normal. The patient looks fine. The blockage is invisible. Push the same heart hard though, and the rules change. The muscle behind that blocked artery suddenly needs 3 or 4 times more blood than the artery can deliver. The patch starts to starve. The sestamide map shows it, and the doctor finally has the proof. That is why the test takes 2 pictures. The first one is at rest, sitting calmly. The second one is at peak stress, after the treadmill or after a drug that mimics exercise. The 2 pictures are then placed side by side. 3 possible answers come out of that comparison. If a patch is bright at rest and dark under stress, that patch is a warning. The artery feeding it is partly blocked. The muscle is alive but hungry. This is called a reversible defect, and it is exactly what the cardiologist was hoping to find before it became a heart attack you didn't see coming. If a patch is dark at rest and dark under stress, the muscle is already gone, scarred, or damaged.
3 answers, 1 muscle. So how often does this test rewrite somebody's life? That number is the next 4 minutes.
How often does this scan rewrite somebody's life? 9 million times a year. In the United States alone. That is how many people get a nuclear stress test. Roughly 1 in 3 of them walk out with a finding that changes their treatment that week. Statins start, aspirin starts. Some go straight to a cardiologist for an angiogram. A small group go to the operating room. But the test is not perfect. About 5% of scans flag a problem that turns out to be nothing. A few miss things they should not. Doctors know this. They use the test alongside the patient's symptoms, blood pressure, family history, and other scans. The picture is one piece of the puzzle, not the whole truth. And the radiation dose is real. About 10 millisieverts for a typical scan, more than a chest x-ray. Less than 3 years of just standing on Earth. The risk of harm from that dose in an adult heart patient is far smaller than the risk of the heart attack the scan was built to prevent. So this is the trade. A radioactive injection, a treadmill, or a drug. 2 pictures, 10 millisieverts. And a doctor who now knows today what your arteries are doing, instead of finding out the hard way in 3 months. Now to the answer to the very first question. What does it look like when your heart almost dies and you don't feel a thing? It looks like a hole on a picture, taken on a Tuesday morning by a camera the size of a fridge. And that hole is the day before the day. If your doctor recommended the scan tomorrow, would you do it? Yes or no?
And if you want to see how the same machine finds breast cancer next month, that is EP10. Tap the channel.